Insomnia is common in the elderly population and can significantly impair quality of life. Non-pharmacologic interventions such as sleep hygiene measures and cognitive behavioral therapy are recommended for initial treatment. Pharmacotherapy can provide immediate relief and should generally be limited to short-term management. So a patient walks into your office and says, "Hey doc, I need help falling asleep." It's your first day as a second-year resident, and you look down at your shiny new prescription pad. Sleeping problems? Psh, this guy needs a sedative, of course. God, I'm so smart. Then your patient moves in a bit closer and clutches onto your hand before it can reach your pen. A cold, sweaty grip. You can see the dark circles under his eyes as he pleads with you. "Doc, I want a pill that will help me sleep without becoming addicted to sleeping pills." Uh-oh. Barbs? No. Benzos? Nope. And then it hits you. Several drugs with novel chemical structures have been introduced more recently for use in sleep disorders. So, because they help you catch some Z's, I want you to remember the 3 Z's: zolpidem, zaleplon, and eszopiclone. Although these agents are structurally unrelated to benzodiazepines, they share a similar mechanism of action. Zolpidem, zaleplon, and eszopiclone work by binding to the GABA-A receptor. Yeah, it's that same GABA-A receptor with the allosteric binding sites for alcohol, benzodiazepines, and barbiturates. So take a look outside and you'll see our recurring symbol for the GABA-A receptor. It's the GABA-A cab, of course. Picking up yet another customer outside of the zolpidem mattress shop. The GABA-A complex, remember, functions as an inotropic channel selectively permeable to chloride. Hence the Chlorider advertisement on top of the cab. When these agents allosterically bind, they facilitate GABA action at the receptor, thereby permitting an increased flow of chloride ions across the membrane. This causes neuronal hyperpolarization, inhibiting synaptic transmission throughout the CNS. So we've incorporated again that CNS taxi light. And to remind you that we're causing CNS depression here, remember that fitting slogan of the Chlorider, "Take it easy." So the reason why the non-benzodiazepine hypnotics like zolpidem are so similar to benzodiazepines? Both bind to the same portion of the GABA-A receptor. So as Tom Hanks over here rushes over to catch the cab, clutching onto his to-go order of Pam cakes from Ben's Diner, he accidentally grabs, or binds if you will, the same allosteric door as this Meg Ryan-esque lady. Their eyes meet, sparks fly, you know how it is. You make a million decisions that mean nothing, and then one day you order takeout and it changes your life. You promised it would always be like this, Cassandra. You promised. So zolpidem, zaleplon, and eszopiclone are selective at the benzodiazepine binding site, so the net neurophysiological effects are similar. And while we're at it, let's bring back our recurring obnoxious inebriated guy, a public nuisance as usual, walking past the GABA cab to highlight the allosteric binding of the GABA-A receptor by alcohol. Remember, that's GABA-A for alcohol. Also, if you squint a little bit, you'll be able to see the barb shop across the street. Just a little reminder that barbiturates also have their own allosteric binding site at the GABA-A receptor. Alright, back to the non-benzodiazepine receptor agonists such as zolpidem, which have a structure that is different from the benzodiazepines and includes a more targeted action at the GABA-A receptor. A consequence of their greater specificity is less anxiolytic and anticonvulsant activity. Therefore, they're mainly used for the short-term treatment of insomnia. Zaleplon and zolpidem have a rapid onset of action, depicted here by the reassuring message that you'll fall asleep fast with the newest mattresses from the 3Z's Mattress Center. See how the sheep go up over the fence and then immediately back down? Let this depict not only the rapid onset of these medications, but also their relatively short duration of action. Look closely and you'll notice that each sheep is marked with a liver spot. Zaleplon and zolpidem have very short serum half-lives, about 1 to 2 hours, and are metabolized by the liver cytochrome P450 system. As a result of their short duration of action, these agents are effective for patients who have difficulty falling asleep, but may not be effective for patients who have difficulty maintaining sleep. So remember that we've emphasized falling asleep specifically in the sign above. Due to the very short half-life of these drugs, the potential for residual hangover effects is minimal after normal sleep periods. Isoprene has the longest half-life of the approved non-benzodiazepines, approximately 5 to 7 hours. Therefore, isoprene is effective for both sleep onset insomnia and sleep maintenance insomnia. Generally speaking, the adverse effects associated with the non-benzodiazepines are similar to those associated with benzodiazepines, but their frequency and severity may be less. This is probably related to their shorter half-lives. Nevertheless, the serum half-lives of these agents may be greatly extended in elderly patients. Just like with benzos and barbs, older adults have a particularly high risk of adverse effects, including excessive sedation, cognitive impairment, delirium, night wandering, and agitation. I mean, just look at this elderly gentleman here, delirious after he's accidentally pulled down this pillow display. As the pillows come crashing down on his head, keep in mind that even these safer non-benzodiazepine agents can lead to balance problems, falls and fractures, and impaired performance of daily activities in the elderly. Ooh, looks like a sale is going on. Should probably read the fine print. Let's see here. Typical. It says here that you cannot combine coupons, which really means you should not combine zolpidem, zaleplon, or isoprene with other CNS depressants. This includes all those GABA-facilitating sedative hypnotics illustrated out front, including alcohol, benzos, and barbs. Watch out, too, for those first-generation antihistamines that cross the blood-brain barrier. At Sketchy, histamine is represented by an allergy-inducing bee. Antihistamines, therefore, are embodied by that recurring bee swatter, of course. Oh God, there's more! Ow! 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 Oh God! Alright, as we fill in the rest of the sign, I want to highlight one of the important differences between benzodiazepines and the non-benzodiazepine hypnotic agents featured in this sketch. After reading the fine print, you'll notice that returns are not tolerated. Let this remind you that zolpidem, zaleplon, and isoprene are less likely to cause tolerance when higher doses of the drug are needed to produce the same pharmacologic effects. Physical dependence is much lower than with the benzos. These non-benzodiazepine sedatives, then, are less likely to cause withdrawal symptoms, and the potential for addiction is much lower. Break those bad sleeping habits should remind you of the relatively habit-forming benzos and barbs. With zolpidem, zaleplon, and isoprene, however, you can reassure your patient that you're not just giving them one of those addictive sleeping pills. And the last thing, if you need to rapidly reverse the sedative actions of the non-benzodiazepine hypnotics, flumazenil is your antidote, embodied yet again by this likely rabid yet unassumingly fluffy dog wearing a muzzle, taking down the sign-twirling guy outside. This isn't like you, Fluffy! Flumazenil is a competitive antagonist of the benzodiazepine receptor, so because zolpidem, zaleplon, and isoprene all bind to the same sites, flumazenil will reverse the effects of these agents as well. Remember, though, the use of flumazenil in the setting of overdose remains highly controversial. Administration of flumazenil can precipitate withdrawal seizures, so watch out! Fluffy, no! Okay, let's finish off this sketch with a quick illustration of the effects of melatonin, an endogenous molecule produced by the brain that regulates your sleep cycle. Ramelteon and Ramelteon are newer hypnotic drugs that act as melatonin receptor agonists. Ramelteon, let your sleepless nights melt away. Melatonin receptors are thought to be involved in maintaining circadian rhythms that are underlying the sleep-wake cycle. Just think of the cycle of this ceiling fan. One light on, one light off. Ramelteon has no direct effects on GABAergic neurotransmission in the CNS. Instead, it's an agonist at the MT1 and MT2 melatonin receptors located in the suprachiasmatic nucleus of the hypothalamus.
The X kind of looks like the optic chiasm, am I right? The suprachiasmatic nucleus then is above the chiasm, kind of like the base of this fan connected to the ceiling. Are you picking up what I'm putting down?
As you know, medication selection for elderly patients requires special attention to this population's increased sensitivity to adverse effects. I mean, just look at that elderly gentleman over there, in the midst of some kind of delirium spell. And all he did was pull out one of those pillows. I told you, Grandpa, you have to do it Jenga style. You have to feel it out. Look for the loose one. You can't just pull them out willy-nilly. Ramelteon is one of the few medications with demonstrated safety and efficacy in older adults. Ramelteon doesn't affect sleep architecture and doesn't cause rebound insomnia or significant withdrawal symptoms. And that's why the old guy here is letting his worries melt away as he tests out the melatonin mattress.
So supportive. Oh, so firm.
Overall, Ramelteon has few side effects and no dosage adjustment is necessary in geriatric patients. So have you found the mattress of your dreams? I'll let you mull it over while I sum up this sketch. When you're trying to recall the non-benzodiazepine hypnotics, just remember the 3 Z's: zolpidem, zaleplon, and eszopicolone. They act like benzodiazepines because they bind to the same allosteric site on the GABA-A receptor. However, because of their greater specificity, they have less anxiolytic and anticonvulsive activity, and they're mainly used for the short-term treatment of insomnia. As depicted by the jumping sheep, they have rapid onset of action and are quickly metabolized by the liver. In general, they are associated with less adverse effect than the benzodiazepines, but as always, watch out for that increased risk of adverse effects in elderly patients, including cognitive impairment, delirium, and agitation. On the plus side, though, the non-benzodiazepine sedative hypnotics are less likely to cause tolerance and physical dependence, so their potential for addiction is much lower, and you can break those bad sleeping habits. Because they bind to the same receptor as benzos, the same antidote also applies, that fluffy yet terrifying flumazenil. Over on the left, we've illustrated everything you need to know about Ramelteon, that melatonin receptor agonist. Melatonin receptors are involved in maintaining circadian rhythms and are found in the suprachiasmatic nucleus of the hypothalamus, kind of like the base of the fan above the X-shaped blades. Ramelteon is one of the few medications with demonstrated safety and efficacy in older adults, so just let your worries melt away. Well, I better get going. Time to don the old sheep costume because that sign isn't going to twirl itself.